Prophylaxis. One should be on the lookout for infection of the kidney whenever a patient suffers from constipation, typhoid fever, retention of urine, furunculosis, or any form of sepsis. The prevention of infection from such sources generally means simply the elimination as rapidly as possible of the source of infection. But certain types of prophylaxis require special insistence, as follows. Prevention of urethral chill. Urethral chill is a possible complication of every passage of an instrument into the urethra. It is inevitable if retention requires a retained catheter or repeated instrumentation. The prevention of infection by gentleness during manipulation, by 1 gram of hexamethylenamine 3 times a day beforehand, and an installation of 1 to 500 silver nitrate following the instrumentation as described on page 271, suffices when there is no retention. Chronic retention, whether due to prostatism, bladder paralysis, diverticulitis, etc., requires the same gentleness and hexamethylenamine and also appropriate bladder drainage. Prevention of infection by posture. Since the so-called spontaneous infections, notably those of infants and young women, are apparently due to renal mobility, these may, except in the case of infants, be prevented by training in proper posture. The patient should spend at least an hour every day in exercises calculated to expand the lower chest by throwing the shoulders back, the chest out, the hips in, the abdomen in, and the toes in. In addition to this, the patient should be encouraged to lie flat on her back with no pillow under the head and a small pillow under the lower chest below the shoulder blades.